I wanted to give you an update on what we're doing and the type cases we're handling for our clients here at the branch law firm, whom we're fortunate enough to represent. We are handling cases involving metal on metal hips, right and left, that individuals are having for replacements caused primarily by metal shavings getting into the bloodstream from the metal on metal hips and causing a condition known as metallosis. Unfortunately, when the metal shavings get into the bloodstream, they cannot pass through the kidney. They cause, as you can imagine, a lot of problems. But more importantly, the problem at the donor site where the acetabular or hip joint is emplaced, that's also metal. The site itself becomes, unfortunately, like pounded meat. It becomes necrotic and dies, and it becomes a very poor donor site for an acetabular joint or the retention of an acetabular joint, a hip joint, and makes the connection or the emplacement almost difficult or impossible. And I think it goes without saying that when the nerve endings are caught between the metal on metal acetabular joint and the hip replacement itself, that the pain can become relentlessly excruciating and unending. If you've had such an experience by having the emplacement of what you learned or have later learned is a metal on metal hip replacement, either an ASR Dupuis, which is owned by Johnson & Johnson, or a Pinnacle metal on metal hip replacement, then I would ask that you give us a call. Let us help you complete a plaintiff fact sheet and see if in fact you have what we refer to as a defective hip replacement. If in fact you do, we would like for you to consider allowing us to represent your interest and see if in fact you have what we refer to as a defective hip replacement.